Hi, everybody. The purpose of this webinar is kind of going to act as a brush up for outreach providers in regards to their HMIS entry. And we're going to go over a couple different things. We're going to be looking at just kind of the standard HMIS data entry, kind of go through a couple different scenarios about how a client works through the outreach process. Going to talk about coordinated entry in regards to street outreach projects and other outreach projects. And we're just going to chat a little bit, kind of talk about some common errors that we find or common mistakes that we find in regards to street outreach. And we're also going to be talking a little bit about the street outreach providers and their role in the COVID-19 response at the COC level. And actually, that's where we're going to be starting today. We're going to kind of be looking at that first and kind of going over a few things that we've added to the system. So we're going to start out on the live site today and kind of look at those and kind of chat about those, show you as an outreach provider the kind of the pieces that make up your piece of the response. Unfortunately, with being an outreach provider, you guys are, that's not unfortunate. You guys do a great job at it, but you're one of the most important pieces in this whole thing. Unfortunately, your data burden is kind of the biggest of everybody's. That's unfortunate, but at the same time, I think you guys are up to the challenge. It's a way to, since you guys are on, the front lines of dealing with this firsthand, your work's really respected and necessary. And it also is very important, and sometimes I'm going to talk about this, is how important, recording your outreach efforts, be it either during times of pandemic or during regular times, how really important it is to track your HMIS entry in outreach efforts in HMIS. Because it's kind of threefold or maybe even fourfold. It's needed for reporting, and that's established. We know that. But it's not just reporting for funders, but also at the COC level. A lot of your outreach activities that hadn't necessarily in the past been really looked at in regards to HMIS entry are really being looked at by funders, but also when we look at the COC, we look at system performance and kind of how we're doing. The outreach is a very important component of that. And keep in mind, too, for path providers that are on the call, your path uploads that you traditionally have manually entered into the path data repository, into that for your path reporting, those will soon be direct exports from the system. They've been working it out for years, and it's kind of at the point where that's going to be happening really soon. So the days of going in, logging in, kind of just manually entering numbers, those are going to be passed, and it's going to be much like a lot of the other reporting that we have to do for projects, and it's going to be just a direct upload from your HMIS data. So it also helps you, a good HMIS entry and database entry helps you organize your caseload and kind of know where every client is within the system as they work toward housing. With outreach, you might have a very varied and very large caseload that's hard to kind of keep track. Everybody is, can kind of keep track, but at the same time, not everybody's memory is that good to where you can keep track in that regard. So it helps you kind of know where clients might be within their service provision, but also keep in mind where how many folks you might be serving, how many folks you might were serving and you're not serving anymore, but you need to exit them from the system, or how many people you're getting housed. That all comes from HMIS data and consistent and thorough data entry. And then it helps us on the COC level and the state level to see kind of patterns and trends and really the most transient of the populations that we serve and report those outcomes. The folks that are on the street, not in a place for habitation, they might move around a good deal. They might stay within the state, they might not, but we can kind of see those patterns of service and determine those. And that really helps us report outcomes of what we've been working on, throughout the COC and the state. And it also aids your clients' progress as they move through the coordinated entry system. It helps them, by having consistent and good HMIS entry. It helps your coordinated entry providers really move a client through and get them to housing get them prioritized for housing based off their needs. And the quicker and the more efficient you get that in HMIS, the quicker they can move through that process. So let's talk a little bit about the COVID-19 response and how it affects you as an outreach provider, and what you can do, and what your kind of roles and responsibilities as far as at least HMIS data entry goes in that effort. The COVID-19 provider is kind of just a separate provider that we've set up within the system that has all the pertinent information related to COVID-19 response in the system. And outreach workers, shelter staff, and now rapid housing and other permanent housing providers should all have access to this provider. Think of this as like a kind of a separate workflow from your standard outreach workflow that you might do for your project, be it ESG outreach or PATH or whatever the case may be. This is something that you do, prior to um, and separate from that workflow. So this is something you do on top of that to really help us at the CUC level and help your clients get screened, get assessed, and record their status in regards to COVID-19. So there's really kind of three components, and with that, there's the screening piece, the status piece, and then the non-congregate shelter, checking into a hotel and different communities, that kind of piece, and the follow-up that goes along with that. Now, as outreach providers, you have a stake in pretty much all three components of that COVID-19 response. There's all three components of the HMIS entry for that potentially. So we're going to be working here for this part in our live site, and I'm just shadowing a user here. And to get into the COVID-19 information provider, it's real simple, like you always do when you go into HMIS. You just go into Enter Data As mode up in the upper right-hand side, and you'll just search for COVID-19. And you'll want to go into this provider, BOS COVID-19 information. It's provider 1948. And they always want to backdate too, even if you're working, with live data entry, backdate to the current day to 1 a.m. or whenever, your actual data entry date is. So you'll set your backdate. And then the first part, or the first two components, kind of the screening and status assessments for COVID-19, happen here in Client Point. So you'll go ahead and search for your client like you always do. We'll look for COVID-19 test. Go into his record. And we kind of go into deeper detail on this in the workflow document that was sent out, but also there's a YouTube video that focuses just on this. And we're actually going to be updating that because we have made some changes to this. But for today's purpose, we're going to talk about outreach and kind of just give you a general run through of it. I mean, you fill out this information on the client profile, like I'm sure you're all used to doing, the client record box, the client demographics box. If the client's already in the system, chances are this might already be filled in, but you want to make sure that it's up to date and accurate. We have added a few additional fields based off of recommendations by the state of California's Non-Congregate Shelter COVID-19 data entry in HMIS. They've added a few fields there, kind of a couple few weeks ahead of the rest of the country in the response recorded in HMIS. They've provided a lot of really great information for the entire country. So we record, the head of household cell phone number. There's a data quality question that goes along with that. The old client phone number and alt phone number questions are still there. Also, head of household's email address and email address data quality. And then of course client residence and last permanent address. Those are all really beneficial to fill out, especially for folks that might be you want to do follow up with, and you want to do follow up with for that are staying in a hotel, that are in non-congregate shelter situations, that you can do follow up with via the different types of contact. We just have standard general information, just kind of universal data elements here that need to be recorded. We do have a new client. What county is the client currently in? That's actually an old data field we brought back. So we'll want to answer that. Just their chronicity questions. And then these questions concerning non-congregate shelter. If they are going into a non-congregate shelter situation, it's best to kind of anticipate um, some of these fields. So we're not 100% sure that these all will be needed, but we're going to anticipate that they will be. So go ahead and complete these. If they have the ability to self-isolate or quarantine without assistance. If the screening results for the qualifying household member, be them asymptomatic low risk, asymptomatic high risk, COVID-19 exposed, or COVID-19 positive. Number of adults in the household who will be going on to permanent housing once they leave an NCS project. Number of children. They have pets in the household, service animals in the household. If any access or functional needs have been identified, and the unit type they might be in. Here in the RCOC, the balance of state, most of the time that'll be hotel or motel for a non-congregate shelter living situation. So we complete that. We save it. They're the same information like with other workflows. You have your households. You can build your households up if it's more than one person. Identify it as a household. Of course, you have an individual. You don't have to do that. But you'll complete that same information for them. ROI, you still need to obtain a release of information. During this time, during the pandemic, especially because we're practicing social distancing and you might not have face-to-face interaction with your clients all the time, you can go back to using the old verbal consent, but you still for release of information, but you still want to record that under the level 2 provider. So if it's under level 3, change it to level 2. It's still 2 years, and it might be like a verbal consent that you can get, and then later on, hopefully, when we can start to kind of find some normalcy, go back to normal, we're starting face-to-face client interaction again. Then we can obtain the signed consent, and you can upload it into the system accordingly. And then next, we come over here to our assessments tab. And there are actually two assessments that you see here. You see your COVID-19 client screening and your COVID-19 current status. So the screening is kind of that first screening piece that you utilize whenever a client either presents for services for the first time. If you for shelter workers, or if we're back to normalcy somehow, and you might be out doing outreach if you have proper PPE, then you can do this client screening, kind of determine what the client's current kind of symptoms are, what their age is, if they're experiencing any kind of COVID-related symptoms, what their age is, if they have any kind of high-risk factors that might make them more susceptible to the virus. And then you can record their screening results here. So again, if they're asymptomatic low risk, asymptomatic high risk, if they've been exposed, or if they're positive. So if you do find them, somebody's asymptomatic high risk or exposed or positive, and they need to go to an isolation center, a non-congregate shelter, or some communities might establish down the road isolation centers, or if you want to get them to testing, you can find in the system news there's a list of testing sites. It needs to be updated, but it was updated a few days ago. But they keep popping up all the time. So you can record that, and then you can determine best practices where that client will end up next. If they'll go to an emergency shelter, or if they'll go indoors, or if they'll go into a non-congregate site like a hotel, then you can make that determination and get them to those within your community. And then the second piece really looks at the kind of their current status in regards to COVID-19. So we just click on that, hit submit, and we see their current screening results that just will carry over from their screening. Their phone number, that other information, contact information that we might have already completed. Which agency recorded this client's COVID-19 current status? So is it WVCH or whatever agency you may be with? Record that accordingly. That way we can know who did the current status. And then kind of just looks at kind of current status related things. Are they experiencing symptoms consistent with COVID? Yes or no? When did their symptoms begin? As a date field. When do they begin isolation? If they're currently in isolation, or if they're currently in quarantine, when did quarantine begin? If they've been hospitalized for COVID-19, either in the past or currently, what day were they admitted to the hospital? And if they were tested for COVID, when they were tested, what date they received their results back, and what those results were. Negative, positive, and then what the current client's current symptomatic, that's a hard word for me. Sorry, symptomatic disposition is. Whether they're currently symptomatic, no longer symptomatic, confirmed recovery, or deceased. What's the date of the current symptomatic disposition? So when were they? When essentially when did you record their symptomatic disposition? And then other kind of general notes in regards to COVID you can put in here. And then if they self-report feeling better or they recover, then you can record that date in here as well. So we kind of do the screening, prior to a placement or going in somewhere, or getting them testing or isolation. Then we do the status. You can do the status, whenever you have contact. I mean, if you contact them every day, of course, you don't need to update that. But if you do it, have contact with them weekly, or if you have contact with them, whenever anything kind of a status might change, then you can update these status questions. So then we hit save. And that might be all you really have to deal with in regards to COVID with the client. However, if they do get placed in a non-congregate shelter situation, we have a few scattered across the COC now. Then you can also record, or you need to record, where they are and what they are, and there might be a lead in your community that's doing this, but you as an outreach worker may be doing it as well. And also you can kind of see who is in that situation and do follow up with them as an outreach worker. So if we go over here to shelter point, sorry, worked ahead. Since we're going over here to shelter point to record this, we'll have to get out of backdate mode because backdate mode is not, you don't use it in shelter point because it works in live data. But if we go over here to shelter point, and then we select our unit list drop down, we see that there's one for Morgantown, there's one for Martinsburg, Fairmont, Parkersburg, Clarksburg, and Jefferson County, kind of those places where we have established sites or will very soon have established non-congregate shelter sites. As time goes on, there may be more added to this list. You'll have to keep in touch with your community leaders, or I'm sure hopefully you're taking part in the efforts within your community already, and you'll know once those are established. If one has been established that we're not aware of, please contact us at HMIS so we can get it in, or contact some of the administrative staff at the coalition, Zach Brown, Rachel Cohen. Contact them to let them know as well if such a thing's occurred and we're not aware of it. So let's take a look at Parkersburg, let's say. Now, this site hasn't been established just yet, but it might be forthcoming. So we already had to put a unit list in just to be sure. So we just hit submit, and then we hit view all, and then we just see a list of beds within a hotel motel that's being used as a non-congregate shelter site. So much like any other thing with Shelter Point, checking them in is really simple. You just click on the green icon here on your unit list on the left. You have to do a search for your client, of course. Then again, under your client results, when your client record comes up, you hit the plus sign, the green plus sign. And there you go. You've checked them in. Now, if they're a member of a household and they're staying in the hotel together, either in the same room or in the same non-congregate shelter site, then you select your other household member here under household members, and then select assign unit. See, we've assigned this unit, bed number 2 to COVID-19 test, but here for path test, we're going to assign bed number 3, let's say, and hit select. And it's important that when you're checking in multiple household members, that you check them in via this view under the household members, and that way they kind of get entered as a group, and it doesn't look like you have a bunch of individuals, even if they're in the household, checked in. So it enters them in as a group, and that's important for reporting's sake. And then again, we see our household or our COVID client current status information. We've already filled this out, but if it's been a couple days, we can update it accordingly. And then save and exit. And we see that they've been entered in our unit list. Now, time goes on, and we kind of do follow up. We work with the client. We get them housed, or we get them, maybe help them get housed, or whatever the case may be, or they might just leave the hotel, the non-congregate shelter site. We'll have to exit them from this list to make that room available, so we know that it's available for a new person. So checking them out's just as easy. You can hear under COVID-19 test, you can hit the minus sign, and that brings up your exit information for this person, but also you have the option of checking out, all the other household members. So we can put a reason for leaving, and we can put in a destination. Now, of course, this is a destination from the hotel or the other non-congregate site they might be in. So then we just hit, we select that, update their status one last time, and then hit save and exit. And now our list has been cleaned, and it's ready for another person to be put in if needs be. So for more information about this, you can find it on our YouTube channel, or also a workflow document that was sent around. But also, we're going to be updating the YouTube video to kind of provide a little bit of extra information for you as things develop. And keep in mind, especially with this COVID-19 response, it is a work in progress. We're kind of learning how to record things, how to kind of respond community by community as we go. And some communities are really stepping up and doing things. Some aren't, and we're kind of at CUC level. We're trying to work with them to make sure that everybody who's experiencing homelessness can remain safe and healthy, and get sheltered and not get infected. And again, if you have any questions about that, you can always contact us in the help desk, HMIShelp@wvch.org. So now keep in mind, like I said before, the COVID-19 piece is kind of a separate little workflow that you utilize just during this response period, and until further notice. We're going to utilize that, but then it's separate from, kind of done prior to or separate from your actual outreach data entry, the workflows that you utilize for outreach, be you a path outreach worker or ESG outreach or some other kind of outreach. So what we're going to do now is I'm going to get here out of the live site and go over here to our training site. And I've gotten logged out of there, so I need to log back into there. And I'll go ahead and shadow a user. Okay. And we're going to shadow a user, and we're going to kind of go through a couple different scenarios in regards to how you might contact and out, or how you might contact or come in contact with outreach for those experiencing homelessness through your outreach efforts, and kind of the different kind of a couple different scenarios, that you might use to record, your outreach efforts in HMIS, especially in regards to street outreach. So street outreach and outreach in general is kind of handled a little differently in HMIS than other project types, be it rapid rehousing or any kind of other permanent housing type of situation. Because when you're out on the street, you might not get all the information that like a rapid rehousing provider or a permanent housing provider gets at the point of entry. You might get just little pieces of information over time, or you might build rapport with the client over time, and you want to record that in HMIS accordingly. You want to record all the information that you have at any given date. However, you might not have the whole picture. But HMIS allows you to kind of build that client record up over time. So on one day you might get this little piece of information. On the next day you might get another little piece of information. The next day you might get all the information you need, get them engaged, get them enrolled, and really start providing services. Or conversely, you might get everything you need at the first point of contact, which is great too. And then you can, work that much faster to kind of get them housed or provide them services. So what I'm going to do is I'm going to go into EDA mode like we always do when we log into the system. And I'm going to look at like a Path Street Outreach provider here. We'll do this one here. And again, even if we're working on the same day, if we've worked this today, we're going to utilize backdate mode. But let's say that we made first contact with this client, or the client we're kind of going to be starting with and working with as at our first scenario. Let's say we first made contact with him way back at the beginning of March 01, 2020. That seems like a long, long time ago, but it wasn't that long ago. So we just set backdate. And so, we're setting the clock back that it's March 1st, 2020. So what we do is, like with most HMIS entry, is we start at the client point module and we do a client search. However, let's say that we don't get the client's name at that first point of contact when we first meet them. We just say, hi, how you doing? We notice that they're homeless or they're experiencing homelessness, and we just say hello. But that's all we do. We still want to record that contact within the system because that's kind of really where our client relationship begins as an outreach worker. But however, we don't know their name, so we can't search for them. But with Service Point as HMIS, you can just create sort of a dummy client name, so like a fake client name until you learn that actual client's name, and you can utilize that as you build your client record. So let's say we're down on 3rd Avenue, and there's a guy who has big old pop bottle glasses or something like that, some distinguishing feature that helps us remember him or her. So let's say we do that. So we can do a search. We'll search for glasses. I mean, we're not really gonna find anything, I hope. Glasses, red suspenders. Okay. So we didn't find anybody there, of course. So we can just add this client with this sort of false information, but allows us to kind of identify them, and then later on we can update the information accordingly. So then we go over here to our client profile. And again, we haven't gathered any of this information yet. We've just pretty much said hi to glasses, red suspenders. Now we might, put in where we saw them here and under when on a regular day. What's the easiest place to find you? So we can say like the 3rd Street YMCA or whatever the case may be. And if we do gather, of course, we do enter in all the information we do gather. So if we get a phone number, we can enter that. If we kind of get some of this information, we can enter that. However, we only enter the data that we obtained that first day. So let's say that first day we just say hello. So we don't know any, of course, information to put on the households or the ROI as of yet. But we do, since we did make contact with a client and potentially a future path client or a future outreach client, then we do want to create a project start or an entry record for them. And then also record that our contact. Because every time you make a contact with a client, be it ever how small, you want to record that in the system. So at the first point of contact, which was March 1st, 2020, we're going to add an entry for this client into our outreach project. So since this is a path project we're shadowing, we're going to just select path as our entry type. Leave our backdate mode set to where it is. Hit save and continue. And then we record our current living situation. Now, this used to be called contacts, and they've kind of beefed it up a little bit for you outreach folks who've been around for a while. You remember, having to record your contacts. Well, now you still have to record the contacts, but you record them in kind of a different manner here via this current living situation sub-assessment. So you record so for every client that you come in contact with at that first point of contact, even if you don't get their name or additional information, you want to record your contact with them. So you just hit add. The start date, of course, was today. The end date was the 1st of March. The end date, you had contact with them on this date. Their current living situation is they're in a place not meant for habitation, let's say. And, their living situation was verified by, and you can just do a look up here. And what this does is brings up all the providers that we have in Service Point. So you can verify it by either yourself as an outreach provider, or you can verify it by if like a shelter verifies it as well, you can record that. Or if they're staying in shelter, they say for instance that shelter says their person's staying here, they can record they verified it. And you also want to record if the client's going to be leaving their current living situation within 14 days, yes or no. And you can use either you make contact with them and ask them this, or if you can use your judgment, yes or no. And if you do say yes for this, of course, there's subsequent questions too. Like, has a subsequent residence been verified? Does the individual family have resources to support our support networks to obtain permanent housing? Do they have a lease or ownership in a permanent housing unit in the last 60 days? And then have they had to move 2 or more times in the last 60 days? And the location details. But that's if you answer yes to this, if they're going to be moving within the next 14 days. So then we hit save. And then we record our contact. Now, there's a lot of other stuff on this assessment, but we didn't obtain any of this information today. So what we can do now is just save and exit out of here. Let's mark no. We've entered them into our project. We've recorded the contact. And now we just kind of go along our way. Now, what a lot of good outreach workers do to kind of manage their list and kind of know who they kept contact with, even if they don't get this information, is go ahead and assign themselves as case manager. So you can do this either when you make that first point of contact, or whenever you do that, or when you engage them later on, you can record that as well. If I was an Irish worker, I'd like to, record that there, so it just helps me keep my list straight. So you can go over here to your case management tab, hit add case manager, select, who it is, your information. You just can select me, and then you have your start date be the 3/1, where you're set to backdate mode. Then hit add case manager. And there you go. You've kind of made them your client, for lack of a better term, because it shows that you've, at least you've contacted them or you've started the engagement process. So keep that in mind. Like, unlike other project types, an outreach entry should reflect everything you may know about the client on the current date. But since you may not, again, know all the required information you need right from the jump at that first point of contact, HMIS allows you to build that record over time. So let's go back and let's say that, we made contact with glasses, red suspenders, and, a few days go by. We started out on the 5th or on the 1st. Let's go to the 5th. And then we can hit set back date. And we'll go back here to our home screen. Of course, if we hit refresh, we can see on our accounts reports, if we have our accounts reports set up to show my clients, that kind of shows us our client load. We can, click on that and look at, we see glasses, red suspenders is there, right? And to set a set accounts report's real simple. You just click on your edit pencil. It's broken out into quadrants. So here's our bottom left one, and we just select my clients. Then we get everybody who we're designated as case manager with. Okay. So that way it kind of lets us keep our caseload straight in our mind, or on in the system. But let's say, a few days go by. It's now March 5th. We're out and about. We run into glasses, red suspenders again. We start talking to them. And we get a little additional information. Like, we get his name, get his other information. Of course, if we get his name, we can always look him up in the system when we go into Service Point. And we see that his name, he lets us know that his name's Steve Urkel. And we do a search. Now, there's already a Steve Urkel in here, but we can, make sure that this is not the client we're working with. Then then what we can do is build off of this client record if he's already been in the system, and then we can build off of this client record if he's already in the system, or we can continue that, or if to avoid duplication, you can contact us at the help desk and we can merge the two records together for you. But let's say that this isn't the Steve Urkel that we're working with or working with right now. So we're gonna hit add new client with this information. And so today we get his name and a little bit more information. We're gonna we're gonna of course have second contact with him today. Kind of get a little bit more information in terms of his name, data quality. We can fix that here in the client record. We'll go ahead and get his social today. Um, if he provides that, of course, record the data quality. His veteran status, we'll get that. And his date of birth. His date of birth type. Just kind of this information. Kind of the universal data elements here. Again, keep in mind with race, only record race if it's the race that that the client identifies, and don't put primary race is black and secondary race is black because that can confuse some reports. And if you see that in the system, if you could fix that for us, help us out, that would be great. Just changes if you see black, and don't put client doesn't know or data not collected or anything like that. Just their actual race. Then ethnicity. So let's say that's what we gather today. And we find out he's not a member of any household, so we don't have to get that information. We still haven't, really engaged him. We just got a little bit of additional information. So, um, so we, got that additional information from the client. Oh, I'm sorry, I see him back here. And for some reason, my entry exit isn't showing up within the system. I don't know. I think I recorded before. Huh. Let me get out of backdate mode. I might have confused it when I changed it. Sorry. Well, that is interesting. Huh. My apologies. Seems to be a weird kind of glitch we found here within the system. Oh, okay. I think what I did was instead of um, doing that, I created a new client with that information instead of updating his current record. I got ahead of myself. Sorry about that. So what you want to do in that situation is go into Glass's red suspenders record and update it. Then we go back here into backdate. to where we were. And of course, we can update all this information again. For the sake of time, we'll just do this part. Okay. My apologies about that. I got talking and kind of confused myself. If we go here to our entry exit, then we do see our former record. Now this is where we just this keep in mind that on this project start date on 3/1 2020, we on 3/1 2020 we just recorded our contact and the information that we knew about the client on that day. So now, as we begin to build our record, we've learned more information about him. We'll want to kind of, record all the information that we know as of this day, 3/5/2020. And we do that via interim reviews. So if we go over here to interim reviews and just hit add interim review, we can just select update as our type, and it'll date to whatever we're set to backdate for. We hit save and continue. And then, of course, we'll want to record our current living situation. So we'll hit add 03/5/2020 with the same end date, the information date. Currently, he's living same place he was before. We can verify this via our same path provider. If no one can verify it, of course, you can leave this clear. If nothing's going to be changed, then we'll say nope. And then we just hit save. So we record our additional contact. And let's say that, this is the day where we really talk to the client. We've got all the information. We're starting to really kind of make the determination whether or not he or she is going to be either a PATH client or an ESG client. We're beyond the point of really contacting. Now, this is called the date of engagement. This is where we are going to engage with that client and either really and start providing them services. So we'll want to record our date of engagement. And it could be, since we recorded here, 3/5/2020. Since we're in a path provider, we also have to do the date of our path status determination, and that can be today. Current housing status, homeless. Do they have a disabling condition? Yes or no? Then, of course, we have to do our HUD verification. So let's say they have a mental health problem. As well as substance use issues. But everything else can be marked as no. Then we hit save and exit. We verify their disability status. If they responded yes to any drug abuse problems, is there a history of opioid misuse or dependence? Yes or no? So based off of that, we've determined the client is homeless, and we've determined their current status. So we've determined that they're homeless. We can enroll them in PATH because they appear to be eligible for PATH. Now, keeping in mind that our date of engagement is today. Now, with other COC or other types of projects, be it ESG, COC, whatever the case may be, um, all the data quality that begins at the point of project start. Now, since so like looking at data quality, making sure all the fields that are necessary to be filled out, all the additional information that has to be done at the point of project start for most project types. Now, for outreach projects, it's a little different, of course, because you can build that record over time, and you do have a point of engagement. So, data quality for outreach begins whenever the date of engagement is. So, it really, you really start looking at that you've captured all the data that's necessary for your reporting at the date of engagement. So on 3/5/2020, you have to capture all the information for this client, even though their project start date was 3/1. The at 3/5/2020, you have to capture the additional information. So that being, we've already captured this information for Steve. We have to now capture his relationship to the head of household. So self, whether or not he has self health insurance. So we'll just, for the second time, we'll say no, and then no, and then save and exit. What his prior living situation is. So, before where he stayed essentially last night. So we'll say place not meant for habitation. How long has he been there? Let's say 90 days or more, but less than a year. When this episode of homelessness started. So let's say it started about a year ago. 05, 01, 2019, let's say. Regardless of where he stayed last night, the number of times the client's been in emergency on the streets, emergency shelter, safe haven over the past 3 years. And let's say he's been there 4 or more times. And the total number of months in the street, emergency shelter, or safe haven in the past 3 years. And we'll say, all told, um, you know, more than 12 months all over the past 3 years. Where the client's located, of course, for most everybody here, it's on the balance estate. Whether or not their homeless status is documented, it's not documented as of yet. If the client has income, yes or no, we'll say he doesn't have any monthly income right now. So we can just mark everything as no, save and exit. And again, mark everything as no for non-cash benefits. Save and exit. If he's had a connection with SOAR, and he might not have had a connection with SOAR as of yet, that's kind of a path-specific question. If he's a DV victim survivor. And then these additional questions, and for the second time, I'm not going to go through all these, but these were added last October. They're really important to answer, especially working with new clients into the system. So answer those accordingly at that point of engagement. So we've gathered all the information we need to for a sufficient path entry, so we can hit save. And of course, if the client is a member of a household, up top here we can hit our additional information as well. We can hit save and exit. And we've, engaged this client into path. We also want to, at this point, record our release of information on the client. We talked about how verbal consent, was fine during this time of, social distancing. But as time goes on and we get away from that, we're going to have to go back to the signed paper consents. And at the point, and that has to happen really kind of at the point of engagement. So is the release granted, yes or no? We also want to, of course, make sure that we change this to our level 2 provider, because we're releasing the information for our whole agency. Or And of course, you'll have a drop down. You won't have, I don't think you'll have this lookup. So it'll be like your agency level, your level 2. So West Virginia Coalition and Homelessness. ROIs are still good from 2 years from the day they start. So 03, 05, 2022. And your documentation will say verbal consent for now. But again, however, whenever we get back to more normalcy, if you will, we'll have to get a signed ROI and we can upload it via the binder clip. So if we look back at our entry exit, we've entered the client in, recorded our current contacts, we've engaged them in the system. We've also assigned ourselves case manager. We did that back earlier so that we can kind of manage our client load. We can start to put in case notes at this point, so we can kind of set goals and work with the client or just general notes. And there's more information on that and other workflow case management documents. But for the sake of outreach today, I'm not going to go too deep into that. But if you want additional information, you can contact us at the help desk and we can help you out with that. But also at this point is where we've engaged them. They're starting to receive services, so we're going to want to record those services. And we do that here on the Service Transactions tab. And for ESG outreach or other types of outreach, it's very important to record services, but it's also really imperative to record them for PATH providers because PATH, you have to report on those specifically in your PATH reporting. So if we click on like view, sorry, I was back there when I was talking, view the view all services tile, then you can kind of see, kind of services this client's received in the past and various needs, services, referrals, shelter stays. So if we click on services, we can hit add service and kind of select a service that we provided. So at the bare minimum today, we've screened this client for the project, so we can kind of go ahead and just select an outreach programs service type, hit save and continue. And since this is a PATH program, keep in mind that you do have to record this. These PATH funded services provided. And this was a screening, right? So we've recorded, we've at least done that much today for the client. And pretty much every client that you take into PATH, you should record at least this service for them because you screen them to make sure that they are eligible for the project, right? You can record the funding source if need be. You can set follow up, etc. And you can mark their needs, maybe move their needs back here to closed. Now, keep in mind, of course, you don't see these PATH-specific ones for non-PATH funded projects, but it is very important that you, with PATH, that you record the various PATH-funded services that you provide. And then you hit save or save and exit. And you see that we've recorded the service for the client. And keep in mind with PATH for your PATH reporting when recording services as well, your funder doesn't necessarily care how many times you provided that service. Like say I provided like 5 different screenings to client 14, to Steve Urkel here. They don't care that you did it 5 different times as much as they want to know how many clients received this service during a given reporting period. So it's very important to at least record one service of each type that's provided to a client when you provide them or as you provide them. And the same goes for PATH referrals. Now, this doesn't pertain at all to ESG outreach or other kinds of outreach, but for PATH, you also have to record any kind of referrals that you make on behalf of your client and report on that. So you can go over here to the referrals tab, either add referrals tile or back here to this referrals tab under all service transactions. And you can hit add referral. And you can record, any kind of referral that you might make to the client. Say they're on the street and you tell them to go to emergency shelter. Now for Path, you can, record, their needs and the kind of the referrals that you're making. And if you don't refer them to a specific provider, you just kind of tell them the places to go, kind of things to check out, then you can always queue here to your provider quick list and select Path referrals and hit add provider. And you can either, select the providers that you're referring them to. So let's say you're providing, you can, here under search results, you're providing them to Bartlett House, and the Beckley VA Medical Center, let's just say. But also, you can just record this general Path referrals as a provider. And what that does is just, kind of acts as a placeholder in lieu of other providers. Because really, your reporting isn't concerned as much as where you refer them to, as opposed to the types of referrals that you're making for your clients. And of course, you can make multiple referrals for multiple clients via this view. And you can check out your workflow documents more specifically about how to make referrals within the system. And then you can hit Save All. Oh, my apologies. I forgot to select a need for this client. So we'll add this term. And let's say he also might need case management. We can do that. And household goods, let's say. Okay. And then also when we're working in Path, we need to also remember to select our type of Path referral right here. And again, keep in mind this is just for Path. So be it if they, the type of referral that you made, community mental health, job training, substance use treatment, etc. Housing services. We make a lot of referrals, of course, in our COC for housing services. So if you refer them to coordinated entry or a permanent housing provider, whatever the case may be, then you can record that as permanent housing or housing services. And then if you know that they, when they made, if they actually are going to go to this and you're going to work with them, or if, you don't know, you can leave it blank for now and come back in later. But if you're 100% sure they're going to go, you can mark it as attained. And then hit Save All. And then here under referrals, we see that we made all these referrals to this client. And again, later on, if we want to do follow up, which you should do follow up, especially around reporting time to report, if the client followed up or attained the referrals that you made, like we know that they went into emergency shelter, let's say, then what we can do is go here to the referral back here on our referrals tab, go into the edit, click on the edit pencil, and then mark this accordingly. Say that we hadn't already marked this attained, we can mark it attained at that point, or not attained if they didn't go after it. So that kind of helps you work. Involves you kind of following up with your client and seeing of the referrals things or what they've done, what they've attained, what they haven't attained, etc. And so we want to, of course, record these services and referrals throughout our service provision with the client. And of course, every time we have contact, we go back here to our client information, or we go back here to our home screen. Every time that we have contact with the client, we'll go ahead and change our back date to let's change it to 3/20. Let's say a couple days have gone by, and we can look them up on our caseload here. So we have 2 Steve Urkels, but we were going to look at client number 10, Steve Urkel. Or my bad, client 14, Steve Urkel, I think is the one. Yeah, sorry. If we want to look at them, so let's say it's been a few days. Now it's the 20th. We run into them on the street. We see here on the client profile that we've made these 2 contacts with him already. We might know that we engaged him on this day, the 5th. Now, since we've already engaged him, he has a project entry record, and we might not even need to go into his entry record to update it. We just made contact just to kind of see how he's doing. Hey, Steve, how you doing today? Doing fine. Nothing really new to report. Just sort of a general contact. We can add that here as long as we already have that project start date established, to kind of save you from having to go into multiple project, or project entry records. You can just hit add here, end date it, information date, what he's currently doing. Is he going to be moving? No. Then hit save. And, we can just record that, that service then, or just that contact at that point. So let's change our back date one more time to the 25th. And let's say, this client's moved pretty quick through the process. We've worked with them or he's still working through the process. But, we made contact with him today, and we find out that, here on the 25th, he has a job. He got a new job. And so we want to update his client record to show that. And he's so what we can do here is go here to Interim Reviews, hit Add Interim Review. It'll be set for today. Just hit Update. And of course, we'll want to record our contact like we do. We can verify yes or no. He's not going to be leaving. So we can record our contact. Then kind of go through our assessment here, make sure everything's up to date. But since we said, we will want to update this monthly income because he's going to have a new monthly income. So let's say he has a monthly income source of yes. We'll change that answer to yes. And we look here on our sub-assessment of the values here. We might have to scroll through, hit previous or next, and go through the different pages here on the sub-assessment. But we don't want to just change this here where it says earned income. We don't want to edit this to make it say yes, and then, with this start date. Because what we want to do is we want to build this class record over time and kind of see the client history through our efforts. What have we helped him or he or she to obtain, to work with, or the client helped themselves obtain. So what we'll want to do instead is through our interim review, we You go here to earned income, click on the edit pencil here, put an end date, and it could be today's date or the day before, is usually the case, of 3/24/20, let's say. So, we know that as of this date, now these aren't the actual start and end dates of the actual income potentially, but they are the start and end dates of the record. So on 3/5/2020 through 3/24, this client reported having no earned income. Now, however, we noticed that knocks our HUD verification off. So we want to verify that they didn't have income from this date to this date. However, we want to record now that he does have income. So we'll just hit add, put in an income amount. Let's say he's getting $500 a month in earned income. He's receiving the income source, yes. As of 3/25/2020, that's what the record shows, that this client has earned income. Of course, we'll leave this open-ended because until we know otherwise. So there we go. We noticed that, our HUD verification's gone back to being green. We have earned income, no, from 3/5/2020 through 3/24/2020. And then if we scroll through, we see that we do have earned income of $500, and he is receiving that income source from 3/25/2020 moving forward. So we don't want to change just one line. We want to record every single line, or every single kind of change on a separate line, kind of like a bookkeeper's ledger. Now, keep in mind that ideally, you should only have one open income source for every income source in the sub-assessment. So one open child support record, one open workers' comp record, etc. Same goes for non-cash benefits. You should only really have 6 open-ended. And for health insurance, you should have 10 open-ended. And if you have multiple ones, that can, means you need some data cleanup, and that you'll need to fix that accordingly. So we've recorded that. We've done our interim review and recorded that he has income now. So we'll go ahead and hit no here, and then we'll save and exit. And now, we've been working with this client for a few days now, and he's ready to be housed. He wants to move off the street. He has some earned income now. We're really going to start working with this client in earnest. He's a PATH client. He's receiving some PATH services, and we really want to start working with this client in earnest to get them into the coordinated entry process, and get them prioritized for housing, and to ultimately get them housed and off the street. So what we utilize here is, for outreach providers, you have a sort of an additional provider that you have to manage sometimes with folks that are within the coordinated entry system. And the reason we set it up that way is because if a client's like in shelter, of course, like we were talking about before, they have to gather all their information at the point of project start, and the prioritization guide looks at that entry record and puts them in the system accordingly. Now, you as outreach providers, you can build that record over time. So at any certain point, up until the point of engagement, you might not have all the information that's needed in order to get the client actively placed or correctly placed on the housing prioritization guide. So that's why we created a separate provider that you utilize to get the client involved in the coordinated entry process for outreach providers. And that allows that you do this after they're engaged with your PATH project or ESG outreach project or whatever the case may be. So let's hop off our enter data as mode for this PATH provider and go here into EDA mode for. We'll search for CES outreach. And what that brings up is provider 1729, WVCHCS Housing Engagement Outreach. So we go into that, and again, we'll have to do a client search. And this time we'll search for Steve Urkel. And we go over to our entry exit tab, and we see that the client is entered in to our Path Street Outreach project, but we want to enter them also into our create entry exit into our CES housing engagement for outreach providers. That provider as well. So that's a HUD entry type. We hit save and continue. And then on this entry exit data screen, it looks a little bit different. We see our housing engagement and prioritization assessment, and we also see our housing actionable assessment. Now, engagement, there's two types of engagement, of course. There's your engagement into your outreach program, which is kind of a separate workflow that you utilize. And then this is where you're engaged, the client's becoming engaged in housing. They're really working on, and you're with your assistants, the case management, they're really working on a housing engagement plan. This is where you assess them via the VI SPDAT, and you gather all that information for them. So, with an entry into this housing engagement outreach provider, the first assessment you do is the housing engagement and prioritization assessment. So, you complete all this information, update this information. Say they've been in PATH for a while. You need to update this prior living situation information so that, if when they came in your project, they might not have been chronic. But now that they've been in your project for a while, you'll want to update this because that will determine their chronicity. You want to record, of course, their client contact information. Then you want to record the questions in green here that are the housing engagement. So which county do they want to be housed in? What category is their engagement? If they're an individual, a family, or a transition-aged youth. When do they engage in housing? And that, of course, will be the current system date. So 3/25/2020. Which agent is the client primarily engaged with? So, like, say that you're a PATH worker, you're an outreach worker, but then the client's also involved with shelter in your community, and they're the ones who are really driving this client's particular, housing plan. They're working with them. The client might work better with them than they work with you as an outreach worker, which is no big loss. I mean, either way, as long as the client's getting housed and they're working with the case manager they feel most comfortable with. So, whoever they're working with, you just mark that accordingly. Then where's the client staying right now? Are they staying outdoors or in shelter? Then their housing option information. Once an option comes available, what size unit may be needed, like the number of bedrooms. If they be interested in like a roommate option. Once the housing option is available, will they require any kind of special accommodations? You record their VI SPDAT based off their type, be it individual, family, or TAY, transition-aged youth. So to do that, of course, you just hit add, and then the additional the VI questions come up for you to answer. And then you kind of record those accordingly. It's important to remember to, record the right VI type to ensure they're going to the right piece of the prioritization guide. Then does the client have any severe mental illnesses or other circumstances that prevent you from completing the VI? Yes or no? And if yes, then what are they? Okay. Okay, so record that accordingly. Then we hit save and exit, or just save, depending upon where we are at the client. Okay. And let's say that we've kind of worked with this client. They become engaged. They're on the engaged piece of the list. When you get on housing calls with the coordinated entry team, um, they are working with them. You're working with them to get them engaged. Okay, and that's great. Um, so then they have everything together. They're ready to be housed pretty much. I mean, maybe they're still staying on the street, but they're ready to be housed. You can move them in right away. You've worked with them to get all the necessary paperwork. Then what we can do is move them on to what's called the actionable piece of the housing engagement process. So we can kind of do that here. We go back to their housing engagement entry exit record. And then we see the second piece up here under selected assessment. We've already completed this, so we select housing actionable. And this is really just a collection of a couple of additional questions. Whether or not the client is trimorbid, like they have a co-occurring disorder, psychiatric or substance abuse with a chronic medical condition. We can record, their trimorbidity. Yes or no. Their current living status situations. And of course, if their VI has been completed, all that. And then if the client is really paperwork ready for housing, like all their documents are uploaded in HMIS. So, I mean, really anything that can get them into an apartment, be it like a proof of citizenship, a verification of disability, a verification of homelessness. I mean, all that information, anything that can really get them into housing that, we have and kind of upload in HMIS that we can utilize. So then we just hit save and exit. And we mark, of course, this accordingly, yes or no. And by marking that yes or no, that will bring them onto the actionable list, and they can work through the housing prioritization process. But of course, this whole time, we're also going to be recording our contacts through outreach and recording path services as they come up, etc. So that's kind of a scenario to get the client, and that's the kind of long-winded, like building that client record up scenario, the one that takes the most time. Now, there might be some circumstances where, and a lot of circumstances where, all this might happen in one day, which is great when then that does happen. Um, so instead of having to build a client record, record all those contacts, and build that client's record up over time, you just very simply just meet the client. You can engage them that first day, record their contact, record their path engagement, record path services or other outreach services, um, you know, get them housing prioritization, get them, enrolled in house and on the engagement piece, kind of get all that together. And it allows you to kind of do that. And then, you can get them there. So let's go back. And of course, the one important part is once we, kind of get them through and get them housed, is we never can forget to exit our clients from past services. When past services or other outreach services cease, the client becomes housed, or we lose track of the client, we'll need to exit them out. So a lot of times people ask us, about exiting clients that, we might say we made contact with a client and we recorded a project start and a couple of contacts, and then we lost track of that client. That client either moved away or we just lost them or whatever the case may be. Um, but so we want to exit them from the system when that occurs, because we don't want a bunch of open-ended outreach entries in the system, because that just kind of bogs down the entire process. So that's why it's really important to utilize your count report. So if you go back to, of course, to your home screen, utilize your count report to see what clients you currently have in. Um, and if you started case managing them like 6 weeks ago and you haven't had any kind of contact with them in 6 weeks, then you're going to want to exit them from your project. So let's say that back in beginning of February, we met a client and had some contact with him, but we've lost track of him. But he's still showing up on our accounts report. He's still showing up on our caseload. We're going to want to exit him out of the system, right? So let's say we'll change our back date. Let's say it's this time around it's April 1st. Oh, it's giving me a hard time because it's getting confused here. Sorry. Okay, so we want to set our back date back to let's say it's April 1st. And let's say, on our caseload, if we look here at our account details report, this guy, Carl Winslow, we'll go into his record. And we see kind of here that, we entered him into our ESG outreach program back on 2/1/2020. But if we look here, either via our entry exit record or on the client profile, we see that we kind of, got some information from him, but we've lost track of him. We don't know really where he went to, and we don't leave these open ended, and that's kind of a big thing. Like some providers, some past providers, and some other outreach providers within our COC, we have to be on constantly, and that's gotta end because we have if you have an open path entry from like 3 years ago, there's no excuse for that. You know what I mean? Exit them from, because that's just bogging down your community's coordinated entry system, having all these open ESG outreach or ESG path, or I'm sorry, path or ESG outreach providers out there. So with ESG outreach, or we'll say we entered them into ESG outreach on 2/1, we've lost track of them. We need to exit them out. So we just go here to exit date. Select a reason for leaving. And we can say, in this case, unknown disappeared. And for outreach, it's okay to sometimes to say, unknown disappeared, or no extra review complete, because we might not really know where that client went to or recorded as other. And then we hit save and continue. And we really can't update any of this information because we don't know if anything needs updated. And then we hit save and exit, and we've exited them out. It's also important to go into your case management tab and put an end date for that in as well. And that way they don't show up on your client list anymore. But hopefully we don't lose track of too many folks. But we understand that that does happen with outreach from time to time. So it's important to keep up on your unit list, your couch reports, your client list, and exit them accordingly. However, let's go back over here to Steve, the record we've been working with. And, we've entered them into our PATH project. We've been providing them PATH services, recording those, providing referrals, following up on those referrals. And we have him in housing engagement, and he's got a job. We've updated all that. He's been really doing a great job. And he now has got into a rapid rehousing project, and they've, taken him in. He has a place. He's really working with them. So essentially, our path outreach services aren't needed anymore. The client's either, gone on to another project, or maybe we've worked with them and they're self-sustaining, and our service and case management isn't needed anymore with this client. So it's time to exit them from our project. And again, much like with we were talking about before, it's always important to exit the client from the system. We don't want a bunch of open-ended exits or open-ended clients within the system. So we need to exit him from both our Path Street Outreach Project and our CES Housing Engagement Outreach Project. So we want to click on our exit date for our path, exit him from that, reason for leaving. Let's say he completed the program, and his destination is rental by client with rapid rehousing or equivalent subsidy. Save and continue. We can update the current housing status to stably housed. We can make sure all this information. We record our final contact with the client, their current living situation. And we do that too. So rental by client with rapid housing or equivalent subsidy. This can be verified by like a rapid rehousing provider that he's going into. So say he's going into rapid rehousing consolidated. And then we can mark if this is going to be changing in the next 14 days. We'll say yes. Has subsequent residence been identified? We can say yes. We can say yes or no accordingly, and answer all these. Based off of that information. Then we can hit save. Update the rest of the information on the assessment as needed. Save and exit. And we've exited them out of our project. And the exit them out of the outreach and engagement, the CES housing and engagement, is a lot easier. You just have to hit exit date. Again, record reason for leaving. And then we don't have to record another contact because we've already recorded that. However, we don't have to update any of this information because we've updated that on our path. So we can hit save and exit. No. And the client's been exited from our project. So hopefully that's the way it turns out most of the time. But we'll see. Okay. So we've kind of worked through that. We've, kind of gone through, shown everything that the client, that most of the time, one or two different ways that those scenarios play out, and the client goes through those different, outreach projects. Are there any questions or anything like that? That's pretty much everything I had wanted to cover on my list. But do we have any questions, Mary Kate, or anything?
I don't see any in the question or the chat box.
Okay, great. Well, I know I kind of went on a little bit longer than I wanted to today, but it's a lot of good a lot of information. I would call it's good information. I'll say that a lot of information in there, and we understand it's a lot of information that can come at you. If you have any questions ever about outreach, recording it in HMIS, I know you guys' outreach burden is or data entry burden is kind of heavy, and we understand that. We appreciate that, and we're here to help you with that. So if you ever have any questions about it, just please contact us at the help desk, HMIShelp at wvch.org. And and if you ever need anything, let us know. In regards to HMIS, I mean, we're not going to come help you move, you know, but but if you need anything in that regard, let us know. And have a great rest of your day. And you guys stay healthy and take care out there during these times. All right, take care.